Hello, I am Dr. Thompson Akwo, the Chief Editor of Health and Development magazine. The annual conference of the American Association of Critical Care Nurses have come to an end. During this period, a lot of continuous education sessions have taken place. Experts in this industry and their product manufacturers have come together. The product manufacturers have presented sessions on parts of clinical practice and technology usage, be it at NICU, or the Neonatal Intensive Care Unit, or PICO, the Pediatric Intensive Care Unit, or the intensive care units related to emergency acute care. Those who are involved in travel practice, airlifting, have also presented during these meetings. It must be noted that many of those that we spoke to talked about the importance of the meeting to them and what they are going to take away from the meeting to their respective homes and practices, be they in teaching hospitals, large group practices, private practices, wherever they find themselves. Trauma, burns, sepsis, and all the other acute conditions that come up in chronic situations have been discussed. There are many who have the opportunity of doing hands-on practice with the simulations which were done. I spoke to Dr. Vicky Good, asking her questions about the future of intensive care practice as it relates to nurses and the healthcare team. And she talked about what is being done, the healthy work environment, work that is going on, and addressing staffing shortages. The new president of the association spoke this morning about her team, talking about rooted in strength. As Dr. Good said, COVID-19 has left nurses who have been involved in COVID practice and work with a lot of resiliency, and has been a strengthening experience as they all benefited from leaning on one another and going forward in hope in their work. The future of critical care is in the hands of those who work with the Joint Commission, with the Centers for Medicare and Medicaid, as Dr. Good said, and others, in making sure that the practice has quality outcomes. The AACN is involved in certification, advanced certification and advanced training. there are many who said this is their first time of attending an AACN meeting, and that they benefited tremendously. The networking, the new friends they have made, the connections, the new technologies they found at the exhibit halls. As they prepare for the next meeting and rendezvous in Philadelphia, they believe that 2022 has been a great outcome, has a great opportunity. And they go feeling that they have been equipped to improve in the quality of care that they give to patients who find themselves in life-threatening conditions, be they end-of-life cases, hospices, be they at emergency units. Yeah, the issue of burnout has featured a lot in the discussions, and there are those who feel that when nurses actually tend to more than one or two ICU patients at the same time, the outcomes reduce in quality. That is true. Reasons why they talk about addressing the issue of staffing. For those who did not come, I want to tell you that the AACN is a great family for you who is a nurse and involved in critical nursing care. And make yourself available. Go to the website, become a member, and then prepare to attend the Philadelphia conference. You got a new president. She's very charismatic, and there is no doubt that she's going to lead the organization to greater heights. She's going to make her own contributions, and she has goals that she's working to meet. So, as the participants meet tonight for the end of conference party, some have already gone, catching the planes and going home. It's also an opportunity for people to relax from this almost 1 week of work, 1 week of soaking that with the experts among this group of highly educated achievers and influencers have done, especially through their leadership. And we of Health and Development Magazine and Media have worked as partners, and we've produced a lots of resources out of here for public consumption. Interviews have contributed in the articles and those resources which are already out there in Health and Development Magazine online. So we look forward to 2023 in Philadelphia, and we thank you for your cooperation and your participation in this meeting. I am Dr. Thompson Akwo, the Chief Editor of Health and Development Magazine, specializing in health and medical communication, or what we call MedCom. Thank you.